Welcome back, everyone. Today, we are diving deep into the world of baby soothing techniques. Specifically, we'll be exploring Dr. Harvey Karp's The Happiest Baby on the Block, and really breaking down some of the surprisingly effective methods that he highlights.
Yeah, that's right. It's a really popular book, and for good reason.
We'll go way beyond just, stopping the crying. It's really about understanding why those cries happen in the first place,
Right.
and then how we can use that knowledge, tap into our baby's biology to really effectively soothe them.
Exactly. I think that's a really important point. Dr. Karp's approach is all about working with your baby's neurobiology.
Yeah.
And it's not just about quick fixes. It's about understanding how their nervous system works, and you can then become so much more effective at helping them calm down.
So let's dive right in. One of the core concepts in the book is this idea of the fourth trimester. Can you unpack that a little bit for us? What does Dr. Karp mean by that?
So imagine this.
Oh.
Your baby spent 9 months in the womb, right? In this perfectly controlled environment, constant motion, warmth, kind of muffled sounds, weightless, floating.
Yeah.
And then suddenly they're born, and they're thrust into this world that's bright and loud and cold, and it's just a huge, huge adjustment for them.
Right.
And so Karp is essentially saying that for those first 3 months, they're still kind of outside womb babies. They're still adjusting to this new environment.
They're not, it's like they haven't quite finished cooking yet.
Exactly. So they crave those familiar sensations from the womb, and that's why they often cry inconsolably. It's not necessarily that they're in pain, but they're just longing for that familiar, that womb-like environment.
So when babies cry excessively during this period, like we always hear about colic, is that what we're talking about?
Well, not always. Colic is often a diagnosis of exclusion, meaning, doctors will rule out other potential causes first. But what Dr. Karp is proposing is that a lot of what we label as colic is really just a baby struggling to adapt to this new world.
Okay.
Their nervous system hasn't fully matured yet, and they don't yet have that ability to self-soothe.
And that's where this calming reflex comes in, right?
Precisely. The calming reflex is like a built-in off switch for crying.
Okay.
And it's an automatic response that's triggered by specific sensations that mimic the womb environment. And Dr. Karp actually goes into the evolutionary reason for this reflex. Imagine, back in our hunter-gatherer days, a baby crying and thrashing around that could attract predators.
Oh, that's a scary thought. So it was really a survival mechanism.
Absolutely. Yeah, the calming reflex kept them safe. It quieted them down. It reduced their movements, and those same triggers that worked back then are still hardwired into babies today.
That is fascinating.
Yeah.
So it's not just about being a good parent, we're trying to figure things out. It's really about understanding these primal needs that babies are born with.
Exactly. Dr. Karp, he's identified 5 specific techniques that are super effective at activating this calming reflex. And he calls them the 5 S's.
Let's talk about those 5 S's. The first one is swaddling, which I think, a lot of parents are already familiar with. But Dr. Karp seems to have like a very specific way to do it.
Yeah. Swaddling is more than just keeping your baby's arms and legs from flailing about. It's about recreating that feeling of being snug and contained, like they were in the room.
Yeah.
But the key is to do it correctly.
Oh.
Dr. Karp emphasizes straight arms, and that helps prevent the startle reflex.
Okay.
And then a snug but not too tight wrap.
So there's a right way and a wrong way to swaddle.
Oh yeah, definitely.
What happens if you don't do it right?
Well, if the swaddle is too loose, the baby can, wiggle free and startle themselves awake.
Okay.
But if it's too tight, it can actually restrict their breathing and be really uncomfortable. So Dr. Karp, he actually recommends a specific technique.
Okay.
It involves wrapping the baby snugly with their arms straight down at their sides, like a little baby burrito.
Oh, I love that visual. It makes sense that swaddling alone wouldn't always stop a baby from crying.
Right.
But it seems like a really important first step.
Yeah, it's really about laying the foundation for the other S's to work.
Okay.
It helps kind of calm them down and make them more receptive to those other soothing techniques.
Makes sense.
Okay, so now that your baby's all swallowed up like a little burrito,
Right.
the next S is side or stomach position.
Okay.
Now, I know this might sound a little counterintuitive because, as parents, we're always told, back to sleep, back to sleep.
Yeah. Back is best for safe sleep. That's drilled into us from day one.
And for good reason.
Right.
But Dr. Karp points out that during those fussy periods, holding a baby on their side or even on their stomach can actually be really calming for them.
Okay.
And think about it. I mean, in the womb, they were constantly in that kind of curled up, fetal position.
Yeah, so it triggers those sensations that they're used to. But we're talking about holding them this way, not putting them down to sleep on their stomachs.
Right. Exactly. Exactly. This is a technique you use when they're awake and upset. And
Oh,
then once they're calm, you always, always put them on their backs for sleep.
right.
It's about understanding kind of the nuances of these techniques and when to apply them safely.
Right, right, absolutely. Safety first. So we've got swaddling, we've got side or stomach position. What's the next step in this baby soothing symphony?
All right, so next up is shushing. And most parents, they try shushing instinctively when their baby's crying, but the key here, according to Dr. Karp, is to shush loudly. It needs to be as loud as the baby's cry to really be effective.
That's interesting. It seems kind of counterintuitive. But I guess when you think about it, the womb wasn't exactly a silent sanctuary, was it?
No, not at all. The sounds of the mother's heartbeat and digestion and blood flow, all of that created a pretty loud whooshing noise for the baby. So a gentle shh just doesn't really cut it.
Right, right. So crank up the white noise machine. I got it.
Exactly.
Okay, what about the fourth S?
All right, so the fourth S is swinging.
Okay,
But we're not talking about, gentle rocking in a cradle here.
okay.
It's all about those small, jiggly movements that mimic the motion that they felt while they were in the womb.
Like mom walking around just going about her day.
Exactly. Yeah. And again, Dr. Karp, he gets really specific with this technique. He recommends small, rapid movements, particularly jiggling the head. That's really what seems to activate that calming reflex.
I've actually noticed with my own baby, she definitely responds more to that more vigorous jiggling than, just gentle rocking. It's almost like she needs that extra stimulation to, like, switch off.
Yeah, and it's important to remember, we're talking about doing this while holding them securely, not just leaving them unattended in a swing or anything like that.
Right, right. So safety always comes first.
Always, always.
Okay, so last but not least, sucking.
Yes.
And this one seems pretty self-explanatory, I think.
Yeah, babies have a natural sucking reflex. It soothes them, helps them regulate.
Right.
And pacifiers can be a really useful tool here. But, Dr. Karp, he even has advice on how to use a pacifier effectively.
Okay, I'm all ears because any tips when it comes to pacifiers are appreciated.
So one of his suggestions is actually a technique that he calls reverse psychology.
Well,
And basically you offer the pacifier, and then as soon as the baby starts sucking, you gently pull on it as if you're trying to take it away.
that sounds a little crazy. Why would that work?
So it actually triggers their natural instinct to resist,
Mm.
and that strengthens their suck and helps them to hold on to the pacifier. It's a bit of a mind game.
I love that. So, all right, so we've got our 5 S's. Swaddling, side or stomach position, shushing, swinging, and sucking.
Yes.
Now, I imagine some parents might be thinking, is this going to spoil my baby? Am I creating bad habits?
Yeah, that's a really common concern.
Right.
But Dr. Karp, he emphasizes that, cuddling and comforting babies during this fourth trimester, it's not spoiling them. It's actually meeting their very real biological needs.
So-
And, it's not about giving in. It's about giving them what they need to thrive.
That makes me feel a lot better because, I've always felt kind of guilty when I pick up my baby every time she cries. But knowing that it's actually good for her, it's beneficial for her development, that's a huge relief.
Yeah. And, Dr. Karp, he also provides really helpful guidance on how to kind of wean babies off these techniques gradually and successfully when they're ready.
Okay.
You're not creating, a lifelong pacifier addict or a baby who can only fall asleep while being jiggled.
Right, right. So we're not setting them up for failure later on.
Exactly.
But what about when the 5 S's just, they don't seem to be working? Are there other things that parents can try?
Absolutely. Dr. Karp acknowledges that sometimes, despite our best efforts, babies will cry. And it's always important to rule out any other potential causes.
Yeah.
Are they hungry? Do they have a dirty diaper? Is there maybe even a medical issue going on?
So it's always a good idea to check those basic needs first
Yeah.
before assuming that it's, just a need for soothing.
Exactly. And if those needs are met and the baby is still inconsolably crying, then it might be time to consult with your pediatrician.
Right, because there could be something else going on that
Yeah,
needs, like, medical attention.
exactly.
And, you mentioned this earlier, but Dr. Karp, he also really emphasizes the importance of parental intuition.
Yes, absolutely.
Like, you know your baby best.
You know your baby
If
best.
something doesn't feel right, trust your gut
Yes,
and seek professional guidance.
absolutely.
Speaking of, parental well-being, Dr. Karp also talks a lot about self-care.
Hmm.
Why is that so important, especially during those really early months?
Well, caring for a newborn, it's incredibly demanding,
It is.
both physically and emotionally. And it's really easy to get caught up in that constant cycle of feeding, changing, soothing,
Mm-hmm.
and and forget to take care of ourselves. Like,
Yeah.
and when we're exhausted and depleted, it's so much harder to respond to our baby's needs with patience and sensitivity.
I can definitely relate to that. When I'm sleep deprived, I'm overwhelmed. Even the smallest things can feel like huge challenges.
Exactly. Exactly. And that's when we're more likely to, second guess ourselves and feel like we're failing as parents.
Yeah.
And so self-care, it's not selfish. It's essential.
Right.
It's essential to being the best parent we can be.
It's about being kind to ourselves, just like we're kind to our babies.
Exactly. Exactly. And he also reminds us that we don't have to go through this alone.
Mm.
Seeking support from our partners, from family, from friends, or even, a therapist, that can make a huge difference.
Yeah, sometimes just, talking about those worries with somebody else can help put things into perspective.
Absolutely. And he also offers some practical techniques for managing anxiety. Deep breathing exercises, mindfulness meditation.
Yeah, those can be so helpful for calming down those like racing thoughts and just bringing yourself back to the present moment.
Exactly. Yeah. Ultimately, I think Dr. Karp's message is one of hope and empowerment. He believes that all parents have the capacity to soothe their babies, to comfort them, and that we don't have to be perfect to be good enough.
That's so reassuring. It really does take the pressure off and just allows us to enjoy these precious early months.
Exactly. Yeah. And it's really about, building that bond and trusting yourself.
Right. And it sounds like, his approach really is all about empowering parents to trust those instincts and to understand their baby on a deeper level.
Absolutely. And one of the things he emphasizes is that parental anxiety, it's normal.
Yeah.
It's actually a biological imperative. It's what kept our ancestors vigilant, attentive to their baby's needs, ensuring their survival.
So a little bit of worry is a good thing.
Exactly. Yeah, it's when that worry becomes excessive or debilitating that it starts to interfere with our ability to parent effectively.
And I think, a lot of parents, especially first-time parents, they really struggle with that.
Oh, for sure.
We're bombarded with information from all sides,
Mhm.
often conflicting information, and we're constantly, second-guessing ourselves.
Absolutely. And Dr. Karp, he addresses this head on in his book, and he reassures us that babies are much more resilient than we think, and that we as parents are doing a much better job than we give ourselves credit for.
It's so easy to get caught up in that pressure to be perfect.
It is, yeah.
Right.
And he encourages us to challenge those negative thought patterns and really focus on our strengths as parents.
Okay.
We need to give ourselves grace and recognize that we're all learning as we go.
It's about being kind to ourselves, just like we're kind to our babies.
Exactly. Yeah. And he also reminds us that we don't have to go through this alone. Seeking support from partners, family, friends, or even, a therapist, that can make a huge difference.
Yeah, sometimes just talking about those worries can really help.
Absolutely. And he offers some practical techniques for managing that anxiety. Things like deep breathing exercises or mindfulness meditation.
Yeah, those can be so helpful for calming down.
Yeah, just bringing yourself back to the present moment.
Right.
Yeah. Well, this has been a really fascinating deep dive into Dr. Karp's work, and I hope that it's, given you some really valuable tools and insights to help understand your baby's needs.
I feel like I've learned so much, not just about, specific soothing techniques, but really about the importance of trusting my own instincts as a parent
Mm-hmm.
and taking care of myself.
Absolutely, yeah. Those are so important. And as we wrap up here, I want to leave you with this thought. What's one small change that you can make today, based on what we've talked about, to create a calmer, more joyful experience for both you and your baby?
That's a great question. And thank you all so much for joining us on this deep dive into the happiest baby on the block. We hope you found it insightful and empowering, and we'll see you next time.